the document visible?
Yeah.
Okay.
Yes.
So the four drugs for today is Helonius, Jonosia, asoka, Lilium tigrinum, or Lilium tigrinum, however you pronounce it. I usually say it as Lilium tigrinum or Lilium tig, and Justicia adatoda. So starting with Helonius dioica, have you heard this medicine? Have anyone of you given this medicine? Any clinical experience you would like to share? Or the sphere of action, somewhere in comparison? Sphere of action, I already told you. But any experience from this medicine? Have you heard this medicine?
Yeah.
Yes, but never really have any chance to practice with this Helonius.
Okay. So you at least know that it is in the female system, right? So before I go, I could say something of this Helonius. It was not a direct experience of mine, but when you go to the symptomatology, we see that this is indicated mainly for bad effects of repeated miscarriage or abortion. So one of my senior, she had a history of 3 or 4 miscarriages, and once she took Helonius by herself, like she was my senior, so she took Helonius. So we don't, I'm not correctly not sure which potency she took, how long she took, I don't have any idea. We also knew that she took Helonius because the subsequent pregnancy, she actually bore a baby. So when that pregnancy, because this was a habitual abortion, we getting to know that uh, she's pregnant, and then 3 4 months later, we get to know, oh, it has been a miscarriage. So we were hearing this story for 3 times or 4 times, three, I think, not four. So when the fourth, when she conceived, we were actually everyone praying that let this be continued, and finally she bore the baby, or she delivered the baby. And after the delivery only, she told that she had taken Helonius because of this repeated uh, uh, ailments from her, that miscarriages in her. Whether she did have other symptoms, what we say in Helonius or what we'll see in Helonius, I'm not sure about it because I was not that close with that senior. We just knew here in the same college, that's it. So that's the only experience I have about this remedy, a very good remedy for repeated miscarriages. And the tiredness, something related to that. So Helonius, it is belonging to the natural order Melanthaceae. Melanthaceae is a family in which we have other remedies like Veratrum album, Veratrum viridae. So even Veratrum album, yeah, you might be remembering it is given for like it is one of the cholera remedy. But Veratrum album is also good for menstrual complaints when there is excessive flow of menstruation or menstrual blood. So that similarity comes from the medicines belonging to the same family. So that's the importance of Melanthaceae and the Veratrum album belonging to the same family, the Melanthaceae. The common name is unicorn plant, star grass, blazing star, etc. The part we use for medicine is the tincture of the root. So this is the plant actually, Helonius dioica. And clinically, as I told, for uterine complaints, it can be, as I told, abortions, miscarriages, prolapse, menstrual complaints, or when there is menorrhagia. We can think about this. And also, it is a good remedy for diabetes, diabetes both the diabetes mellitus and diabetes insipidus, and usually in the initial stages of diabetes. And this is also good for kidney complaints or the glomerular nephritic syndrome, nephrotic syndrome, even that it is good for. So, the characteristic feature of this drug is it is truly been called, or it is with justice, it is called as a uterine tonic. And now this sentence is coming from J.H. Clark, And I always, as I say you, the initial part of my notes, it's actually very concise. Very, I mean, if you're studying for the exam purpose, only the initial portion will be enough to write for an exam. So in that, I have not differentiated from which book I have taken. It is a agglomeration of the symptoms from Boric, from something from Clark, and also from uh, Alan's keynote. So, the initial one, as I always say, this will be very concise for the exam purpose, but detailed one will deal later. I don't want to delete all these things because for exam, it's always really only this much you need to remember. So, so this has been called with justice as a uterine tonic by J.H. Clark actually. And the ailments, it is from the bad effects of abortions and miscarriages, frequent abortions or miscarriages. The constitution to whom this is especially suited to. So we can say two particular constitution in which Hellenius is indicated, and both are actually two extreme constitutions. So it's especially suited for women with prolapse of uterus, and this prolapse should be from atony of the or uterine atonicity, or the tonicity of the uterine muscles ligaments have been lost, and because of that, if there is a prolapse, then that's a condition of the constitution in which it is indicated. But how this loss of tonicity or atony comes up in the uterus, that matters. In case of Hellenius, this atonicity of or atonic nature of that uterus, it can come up either due to their lazy nature or indolence, because they have been living in very luxurious manner, or it can be the exact opposite, where a woman is toiling and hardworking physically and mentally, that finally she's overtaxed or because of her overexertion, her muscles burn and ache. So we get that prolapse. See the two different constitutions. Uh, Another important medicine that which we can think about in case of prolapse will be sepia. And in sepia, we say the constitution or this prolapse is mainly due to overexertion. She will be having that backache, and it's usually a washerwoman remedy. So it is that extreme physical exertion that is leading in prolapse in case of sepia. But in case of Hellenius, the importance is that there is prolapse, and that is due to the relaxation of the uterine musculature, uterine ligaments. But this can happen in two extremely opposite constitutions. Either this loss of tonicity can happen in women who are living in extreme luxury, so they don't have to do any kind of work. They're very indolent, very lazy people. In them, that can happen. Or the extreme opposite, the women who have done so much hard work mentally and physically that they are overtaxed, their muscles burn and ache, they're so tired, but they cannot sleep. So, see the beauty in which the Hellenius is indicating the same complaint, but two extreme or two opposite constitutions. Let us see what I have put over here. Yeah, so this is an explanation for atony, the lack of normal tone or tension in the uterine musculature, and indolence, which means laziness. So it suggests that Hellenius remedy may be associated with a state of reduced vitality or energy because of indolence and also living in luxury. So these women, they will be extremely nervously broken down or nervous. This it's especially suited to nervously run down females. So the nervous depression is highly characteristic. They are easily fatigued by any work, either due to indolence, they do slightest of the work, they are easily fatigued, or they have done enough of hard work that the slightest they do, they are getting overtaxed or their muscle is aching. And they will be having a complaint of backache, a very tired feeling. So this one, when we take each symptom, we can make a comparison. The nervously run down or nervously the depression that being too prominent, we can think about picric acid, where the nervous depression is so prominent. And then when we come to the tired backache, the one remedy, almost all the prolapse medicines will be having this backache, but as I told, sepia will be the. And in case of Helonius, that tired backache, this tired feeling that is running down to the limbs, that is highly characteristic feature. In case of sepia, there is a backache, but it is said in sepia, the pain from different parts of the body finally concentrate to back. That is how the sepia backache has been explained. But in case of Helonius, though they are having that backache, highly characteristic, a tired feeling, later we'll see a lot of adjectives being used over there. There is a sensation of heaviness, dragging sensation, weakness, we'll go through it. But whatever that is, it which is concentrated in the back, it is not just seen in the back, the lumbar or the sacral area, but it is getting extending down to the feet also. That is the aching nature or the tired backache of the Helonius is. And another important feature is this backache or that achy feeling, it passes off after they commence to work. And this is an important symptom. We'll get into the details later in other words, but I'll say you what that means. This medicine actually, when you're just going, we just forget about uh, uh, the uterine prolapse complaint. Just for a second, we forget about this. We just see there is a backache, and the person is having that backache or that feeling that is going down the limbs, and then when the person is working for some time, that that is getting relieved. So when we hear only this symptom, and we don't get to know that the prolapse, associated prolapse or anything, we just don't get the symptom. Only this thing is the one of the medicine that we first it comes into our mind will be about Restrox. So even in Restrox, we have this.
Hello.
Use this.
Cannot listen. Cannot hear anything, lah.
No, you can't hear me.
Hello.
Others, can you hear me?
Yeah,
Yeah,
can hear.
can.
We can
Uh,
hear everyone. Naim maybe cannot.
Yeah, Naim also we can hear. Maybe I message him.
Okay, I have given him access again. Let's see. Nine.
Okay. Now can hear.
Now you're here. Okay.
Sorry. Yeah.
Okay. So, so we just forget the prolapse for a moment, and we see that there is a person who is having backache, and when he started to work, he is having extreme that aching pain and all. But after some time, after commencing the work, there is a amelioration. So we think about Restrox, but the difference between Restrox and Helonius is that in Restrox, it is actually the exact feature, the rheumatoid arthritis feature, where there is a stiffness that is characteristic of. And when we learn rheumatoid arthritis, we also learn that it is a pathological or a disease symptom, that the stiffness will be relieved after the person starts to move the joint center. But in case of Helonius, though we see a similarity of symptoms like that, it is not exactly what is happening in Helonius. Helonius have a very peculiar nature that they have uh, amelioration of complaints when they are not thinking about it. They have amelioration of complaints when they are not thinking about it. And we have other remedies also for the same complaint, that is what are those remedies? Calcarea fos, oxalic acid, medorinum, gelsemium, and barytacap. So these medicines, I have given it somewhere else. Somewhere else, I have given those comparisons. So these medicines, Helonius, calcarea fos, oxalic acid, barytacap, medorinum, All these remedies, they have an amelioration of complaints when they are not thinking about it, or rather, when they are involved in other works and not thinking about their disease complaints, or they forget about it and they're so involved in their work, they tend to forget their complaints. But we have the exact opposite also. When they are thinking of the complaints, they feel so relieved. And though we have the two remedies, camphor and also helibordus. But as I told you, it is coming somewhere. So that is the importance of this. So when we say this symptom alone, that there is a relief in case of Helonius patients, the complaints being relieved after they start working. It is nothing related to their physical complaints or what we say the physical stiffness of joints being ameliorated, as like we say in Rustox. The movement is amelioration, not that. It is the mental thing that is working. When they are off their mind from the complaints, they feel a great relief. So when they start their work, they will be having a lot of aching nature, this languor or stagnation. But once they start working, they feel better. And even this, Boric has explained that the person, actually the one who is very living in much luxury, and they don't have any other work, so they are always thinking about their complaints. They will be always feeling that aggravation, and when the doctor comes to meet the patient, even at that time when she is speaking to the doctor, she is turning away her attention from that complaint. Even that gives her relief. So there is no need that she does any work and then only there will be an amelioration. But even the mind being shifted, even the visit of the doctor and then her mind being shifted from the complaint, that gives an amelioration. So this is actually an important sentence. They will be extremely nervous, weak down, or worn out sensation will be there. They are easily fatigued by any work and who complain of tired backache and tired feeling, which is extending down the limb. They are easily fatigued by any work means the luxurious one. And as I already told, either they are luxurious, even the least work they are going to bother, or they are overtaxed. That the slightest they do, they're getting to be easily tired. But once they start doing or commence doing, continue doing, take their mind off, they feel completely relieved, or that languor it reduces after they commence to work. So that is the constitution, the two extreme constitutions, and then the nature. And in the mind, they are very irritable, fault finding, or censorious in nature, and cannot endure least contradiction or receive least suggestion. So a kind of Naxwom personality or a lycopodium personality we can see in case of Helonius. Very much irritable, very much fault finding. She can't endure someone advising her or someone contradicting her. She can't endure. So that much irritable patients there were. So when this comes, I really don't know. When I was saying you the case about this senior, I don't know whether later after three uh, uh, abortions, did she have such a mind change? I don't know about it because, as I told you, I was not very close. But before to that, I mean, before to her marriage, everything, she was very pleasing nature at that time. But after that, whether did she change mentally, I don't know. But anyway, the Helonious mind will be like that, quite irritable, fault finding, and mostly because if a woman and the complaints are concentrated in the uterine region, definitely she won't be very happy, pleasing, never. She's going to have some or the other, the gloomy nature or extremely irritable. That's very obvious to happen. So they have profound melancholy, deep mental depression, always better when occupied, when not thinking about the complaint. She is very restless, must be continually moving about, and this motion also actually makes her aggravated. But when the motion actually is aggravating, but still, when her mind is taken away from that complaint, she will be feeling much relief. In the female reproductive system, the menses is too early, too profuse, and here it is told that patients lose more blood than is made in the intermenstrual period. So that much profuse bleeding is the in between the. It's told that in between the or the intermenstrual period, how much blood is being formed, more than that they are lost. So here we can compare with another drug, that is Thalaspi bursa pastoris. Have you studied this medicine, Thalaspi?
Not really.
Okay, Thalaspi is also
Thalassemia.
Thalassemia is actually given for menorrhagia conditions. And there is a sentence that we can almost similar. It is more than the blood quantity. It is about how the patient feels. That can be compared between the Helonius and Thalassemia in case of menorrhagia. So in case of Helonius, when we say the patient is losing blood more than what is formed during the intermenstrual period, which shows that the extreme hemorrhage is there. In Thalassemia, the sentence told is the patient will be so exhausted during one menses because of a extreme or a profuse hemorrhage or the profuse menorrhagia that she is scarcely able to recover from one period that the another one starts. So that is how the comparison made. In case of Helonius, it is being compared that in between that two periods, the blood is not formed that much or more quantity of that blood that is formed, it will be lost in the consecutive periods in case of Helonius. And in case of Thalassemia, the how it is explained is there is profuse hemorrhage or menorrhagia, and the person is so exhausted, so weak that one period has finished and she is not able to recover physically, not the quantity of the blood, but physically she is not able to recover from that exhaustion of that previous period, the next one started. So that is how they make a comparison. We can make a comparison of Helonius and Thalassemia menorrhagia. One is saying about the loss of blood, the quantity of the blood, and another is comparing with the physical exhaustion that might feel during the intermenstrual. So the intermenstrual period is not enough for one drug to produce enough quantity of the blood to be lost in the next or the consecutive menses. And in other medicine, the intermenstrual period is not enough for her to recover from the exhaustion of the previous menses. And even before she recovers, the next one started. The flow in case of Helonius will be passive in nature, dark, bloated, and offensive. There can be complaints of mastitis. The breast will be swollen, nipples painful, and also tender. The sore sensation, and the most important feature in case of Helonius will be a sore sensation or a heavy sensation that is felt in the pelvis, especially the area where the uterus is present. So she always have a sensation of her soreness or a consciousness of womb. And now this is beautifully explained in Farrington, how this is, as I told, this is the initial portion where I have completely kept the sentence together without giving much explanation. But when we go there, we'll see the explanation. Usually, and that explanation is given in Farrington. Usually, I mean, when we think about our complete organ now for a moment, when we are sitting like this, all our organs are functioning. My heart is beating, my brain is working, my kidney is doing its filtration work, my lungs are doing its respiratory work, GIT is involved in its own work. Every organ is doing the supposed work for that. And I'm not aware of that. But in case one person is aware about it, I'm not now when sitting over here thinking, oh, I could mark the position of my lungs or my stomach or any other organ. I can't do that. I'm not even aware of those things. But when a human being is conscious about one of the organ, which means there is some or the other problem with that organ. So that is the case in case of Helonius. The Helonius, because the lady is having uterine complaint, she's always having this consciousness of a womb. That she always feels that the uterus is present over there, which is not normal, which is abnormal. And that it is because there is some abnormality. And this consciousness of a womb we can see in other prolapse remedies, especially in case of murex, lilium tigrinum, the one medicine that we are going to learn next, and also in case of syphilis. So all the medicines where we say there is a prolapse condition, they have this consciousness of womb or the source sensation. So that is another characteristic of Helonius. She feels when she is moving, uterus is also moving. It is so sore and also very tender. There is relaxation of uterine ligaments, I already told you, either due to luxury or she has not done any work, or it is due to overtaxing. Or can be any misplacement like retroversion, not just prolapse, retroversion. And that conditions or the misplacements, prolapse, etc. can be removed by Helonius. Then Helonius, it also produces irritation in mucous membrane. So all the organs, when there is a mucous membrane lining, there will be irritation. It is so visible in the mouth where we can see a sore mouth. Also in the GIT, the stomach, where there is a irritable stomach. Burning and scalding when urinating. Now, this symptom we can connect with the glomerulonephritis. We already saw there is this is indicated in glomerulonephritis or one of the clinical condition. So there is irritation in mucous membrane, but the most important, even if you forget all the other symptoms, it's okay. But the most important in case of Helonius will be the irritation that is felt in the vaginal region, the vaginal mucous membrane. Or clinically, it is a very good medicine for vulvovaginitis. So all the STIs, so we can also connect the STIs being resulting in the frequent miscarriage or the abortions. So even for that condition going via light, you can think about Helonius. So there will be, it is greatly indicated in vulvovaginitis with intense pruritus, the labia and the adjoining skin being very red and swollen, and it is covered with thin white curdy deposits, which is exactly showing candidiasis or trichomoniasis or similar STI conditions. So as I told, these STI conditions can also lead to abortions. So that's also a feature of Helonius. Never forget the symptoms, because we ultimately, after learning a lot about a drug, only a few symptoms come to our mind. And one of the symptoms when we think about Helonius will be that constitution and the prolapse, the malpositions, etc. But we tend to forget the vulvovaginitis or the leukorrhea nature, which is very important actually for them. So there is a thin albuminous leukorrhea when it is coming from the uterine, but reaching on the vaginal region, it gets coagulated and it forms small curds, exactly what we see in case of candidiasis. And that covers the mucous membrane of the vagina and vulva. And in urinary system, there is albuminuria, where the albumin is coming out or excreted via urine. It can be given for the albuminuria, which is acute or chronic, and also during pregnancy. Concomitantly with this albuminuria, we can see weakness, which we have already told, languor, the specific nature, the stagnation, the drowsiness. They're very extremely tired, yet knows no reason. So all the symptoms what we have discussed in their constitution, that they're extremely tired, that languor, that drowsiness, it can be seen associated if they have the complaints of albuminuria. And albuminuria, it can be acute or chronic during pregnancy. Now, when we can just convert this Materia medical language into the clinical condition. Can you say me a condition in which there is albuminuria, the condition albuminuria, which is the clinical condition? And the protein is being, albumin is the protein, or proteinuria. Protein is being lost via urine, which is the clinical condition. Yeah, please say. Someone has opened their mic. Please say, which is the condition?
No, kidney problem.
Kidney problem. Yeah. Can you say me exactly which is that clinical term?
Diabetes.
Huh?
Diabetes.
Diabetes. Ma'am, did you say diabetes?
I don't know. But kidney problem, I don't remember the clinical condition.
No, no. Did you say me diabetes? Because I'm not hearing it properly.
Oh, I thought it was diabetes.
Diabetes, not exactly, but yeah, diabetes when it is going towards chronic kidney damage in a chronic condition, and then the kidney filtration,
Nephritis,
the glomerular filtration has affected. Yeah, it can. That
nephritis,
more nephritis, it is nephrotic. In nephritis, it will be RBC that is leaving.
yes,
Nephrotic, it will be
bleeding,
the yes, nephrotic, it will be the proteinuria. Okay, so
mm,
one condition is nephrotic syndrome. And now,
yeah,
can you say me when we say during pregnancy there is albuminuria? Uh, there is another clinical term that is used for that condition. It is not, at that time, we don't use the term nephrotic syndrome. Of course, albuminuria is a nephrotic syndrome. That's the first condition I could say. But albuminuria, when it is seen during pregnancy, albuminuria along with some other conditions during pregnancy, we call another clinical term. Anyone know about that? Who is our little Farah? Is she the Farah? Should call her name in between just to know. So, anyone knows this condition, albuminuria during pregnancy?
pre, pre,
Yeah, yeah, yeah.
pre-eclampsia.
Yes. Preeclampsia. So preeclampsia, we have the symptoms where there is proteinuria, there will be edema, and there will be hypertension. So preeclampsia, and then if along with these symptoms, if the patient is having convulsions also, developing convulsions, it will go towards eclampsia. So this is indicated in preeclampsia. Now that also we can connect to her the nature that of this miscarriage and also stillbirth or abortions, whatever we told. Usually, as a preeclampsia, when it is properly managed, there is not much risk for the mother or the fetus. But if it is not managed properly, and then if it is going towards the eclampsia condition, where the patient is developing even convulsions, then there can be risk. There can be IUGR or intrauterine growth retardation, or the fetus will be not growing in a proper size. It can result in preterm birth and also even stillbirth conditions. So we can go like that also, the eclampsia condition. So this is how we can connect clinically to Helonius. Then this is another remedy. I mean, as I told, it is given for the diabetes in the first stages. So the urine will be profuse with, it will be clear in nature with the increased quantity of sugar in it. There will be symptoms of dehydration where the lips will be dry, sticking together, great thirst. All the other symptoms are actually the common symptoms. There will be restlessness, and this restlessness we have already explained how it will be once the person starts to move about. Moving about is actually aggravation, but when her mind and body is taken away from the symptom, she will be having much amelioration. And physically, the patient will be much emaciated, mentally irritable, and melancholy. So all the symptoms what we learned about their constitution that is being repeated over here. Only that the specific symptom is diabetes in the first stages, and then if it is diabetes, the urine will be very clear with lots of saccharine or sugar present in that, and the signs of dehydration. So nothing that much confusion over here. So this is Helonius. For an exam point of view, well, you have to remember the constitution, the prolapse condition, either highly luxurious women who doesn't have to do any work or highly overtaxed women. And they have that constant backache, which is actually going towards their limbs. And though movement is aggravation for them, but they feel much amelioration when they are involved in some work because they have amelioration of complaints when they are not thinking about them. Mentally, they are very irritable, censorious, and also can't bear the least suggestion, can't bear the least contradiction, very melancholic and depression. Then we see that there is profuse menorrhagia, the nature of the blood being passive, dark, and clotted, the soreness and consciousness of a womb, which is also highly characteristic in other remedies where there is prolapse, especially sepia and murex, and even in case of Lilium tigrinum. Then bad effects of abortion. Don't forget that vaginal mucous membrane being affected and how you can connect it to the frequent abortions, the STIs being leading to that. And in urinary system, either for the nephrotic syndrome or in the, if it is during the pregnancy, how it connects to the preeclampsia and the abortions henceforth. The concomitants, which is exactly the constitutional symptoms of the drug, the diabetes. Then modalities, aggravation from motion, touch cannot bear the least pressure of the dress, especially the organs, the breast, nipples, and kidneys, they will be having that aggravation. But amelioration is from mental deviations. This drug is similar to another important small remedy, that is Alectris farinosa. This is usually, Halonius is actually given in smaller potencies, 30, because most of the proving has been done in smaller potencies. And we can see when we go to the other textbooks, when higher potencies were given, unnecessary aggravations and recurrence of the symptoms were seen. So it is always usually given in lower potencies. And Alectris farinosa is another medicine which is almost similar to in case of this one, this Helonius. Actually, both are botanically same. They also belong to the same. Melanthaceae is actually a suborder. The main family is Liliaceae, I think, and Alectris is also belonging to Liliaceae family. Even Lilium tigrinum, that is also belonging to Liliaceae family. So botanically and also therapeutically, Helonius is similar to Alectris farinosa, and Alectris is usually given in tincture form. This is also indicated for patients who are having anemia. There will be prolapse condition, defective nutrition with protracted illness. There is a section coming in detail about Alectris farinosa. So now going to each book, starting with Borik's Materia Medica. So the constitution we have already seen. And in case of Boric Materia Medica, the keywords that Boric give to explain the Helonius constitution are these three words, or rather five words. The first one is a weakness, dragging, and sensation of weight. That what we learned earlier, the tired backache. Now, in case for an exam purpose, you need to remember only a tired backache, nothing of this sort. But when it comes to the Boric, where the explanation comes, Boric has explained that in three terms: there is a weak sensation, a dragging sensation, or a weight sensation that is felt in the back. That's the sacrum and the pelvic region. And along with that, there will be great languor or the instagnation or the stagnation nature, and also extreme weakness or prostration. So this is a these are the five terms given by Boric to explain the constitution in which Helonius is indicated. So the three pillars or the three corners, we have this weakness, dragging sensation, and a weight sensation in the back, concentrated in the back. And generally, concomitantly, the patient will be having all throughout that prostration and languor nature. Languor is a very much inactive, stagnated one. That is languor, or very low vitality. They don't have the strength to do even the least work. That is languor. So the weakness, in case Boric has explained that this weakness, we can see it physically as a tendency of uterine prolapse or any malposition of the uterus. The patient will be having a tendency or a sensitiveness, which is expressed as consciousness of a womb. We already told that they will be tired and backache females. We also saw that there is actually albuminuria in these patients. So Boric has said that actually this is an explanation which is coming from Farrington. the menses is often suppressed and the kidney congested. We learned actually in case of Helonius, the menses will be too early and too profuse. But when there are some kidney complaints associated, there is a glomerulonephritis or something, what happens is there is a suppression of the menses and the kidneys being congested. Or how they explain is every month when the periods has to appear, there is a monthly congestion that should happen in the uterus. But in these patients who are having these kidney complaints, for them it happens that instead of venting itself or the uterus being getting going through the congestive stage and venting it out in the form of menstruation, this congestion, it is extending to the kidneys, not in the uterus, it is extending to the kidneys, and it feels that the kidneys are getting congested, and the resultant will be a albuminuria. And if the urine, I mean, if there is albuminuria, the protein being passed in the urine will be actually scanty and turbid. So this is how they have explained. Earlier, for the exam purpose, when we learned there is a albuminuria, acute or chronic, we just stopped by that. But here comes the explanation that most of this condition, it will be like when there is an albuminuria, there is a suppression of menses. So every month during menses, the uterus should be actually going through the congestive stage. And if it is not, the fertilization is not happening, then that congestion is relieved in the form of monthly menstruation. But when the patient is having a glomerulonephritic condition or the kidney is being affected, it feels as if that congestion has been taken away from the uterus and it is now placed in kidney. Kidney is undergoing through the congestion and the resultant will be albuminuria instead of menstruation. So we have the urine that is scanty and turbid. And whenever there is the kidneys being affected either by glomerulonephritis or anything, there is a constant aching and tenderness over kidneys. Can trace outlines of kidneys because of that constant burning pain. Now, this we can also connect with that sore sensation that Helonius patients are feeling when they are having the uterine prolapse condition. Earlier, as I told you, when we are having, we are never knowing what is the position of any of our organ, or when it is working, functioning normally, we are never knowing anything. But when we are conscious of a particular organ, a pain is being felt or something is felt, there is some other abnormality. So in case of Helonius, when they were having actually the uterine prolapse, there is a sensation of a conscious sensation of womb that is present when the patient is moving. The uterus is also moving, and there is a sore sensation. There is a tenderness that is felt. And similarly, if it is the kidney that is affected in case of Helonius patient, there will be a burning pain, and the patient can extremely feel, and it is told that along that burning sensation, we can trace the marking of the kidney. So that much very prominent sensation or that burning pain they will be having when they have the kidneys affected. And along with all these complaints, there is a profound melancholia. The patient must be doing something to engage the mind. And here comes, I told you, the aggravation from thinking of complaints. So when they are taking away the thoughts from these complaints, they are feeling relief, or they're having complaints when thinking about it. So these are the remedies: Helonius, calcareous, oxalic acid, medorinum, gelsemium, and baryta cup. All these medicine, they have aggravation from thinking complaints and amelioration. While thinking about the complaint, it will be camphor and hellebores. Now, I can say you an anecdote from my BHMS, okay? How I used to remember. This one, somehow I had to mug up the medicines. Helonius, calcareous, and oxalic acid. All these I had to mug up. This one I used to remember amelioration from thinking the complaint. So I always used to think the patient is actually, if the patient is in a dying stage or something, and he may be having so much um, uh, physical pain or suffering from his complaint, that these patients will be very happy when they think of the complaints, or when they feel like, okay, if that comes, they are going to have amelioration from these complaints. So now how I connected this, the term camphor and Heliporus. Now take only camphor. If you know the Hindu custom, when a person dies, in front of his dead body, we burn actually camphor so that good smell comes. And just think, this is getting recorded, but still, just think the person who passed away is going to hell. So I used to connect like that the two medicines that is connected to death. So they feel an amelioration when they're thinking of the complaint because they are in the end stage. So when they think that, okay, the death is going to come, or they think about their complaint, they feel much amelioration. And to just remember, it is not, okay, this is not something related to their therapeutic explanation or anything, nothing, okay. This is a story that I created myself so that I remember, oh, it is the camphor and Hellebores because they are dying and they are going to hell. So thinking about the complaints is giving amelioration. Amelioration. So I remember these drugs like that. But the other one I had to by heart actually. And why we need to by heart? Because in for our exams there used to be Viva OC, where the teachers will be asking these questions they will be asking aggravation from thinking of the complaints, then we have to give 3 or 4 remedies. So that's how why I had to by heart. So I only remember the other thing also, the amelioration from thinking the complaints. The other two only I remember. It's very difficult for me to remember these 5. So coming back, remember this drug that is biboric for women with prolapse from attorney innovated by indolence and luxury, or for those women who are worn out with hard work, tired, strained muscles, burn and ache, and sleepless. This is the exact sentence that which I put above. Then it can be given for diabetes mellitus or insipidus, where the urine will be with albumin or phosphates. It can be profuse and clear, and in case of mellitus, it can be with saccharine. Now, earlier we told that there is a comparison with Alitris farinosa. So now we'll see what is the comparison. So in case of Alitris farinosa, the one is it is botanically related. As I told, Helonius, though we say Melanthaceae family, the main phylum is actually Liliaceae. The subphylum or the suborder or something is Melanthaceae. So both of this, Alitris farinosa and Helonius, they belong to the family Liliaceae. So they're botanically similar. And in case of Alitris, the lady is actually anemic patient, relaxed condition, especially of the female organism. The patient is tired all the time, suffered from prolapse, leukorrhea, and rectal distress. There will be chlorotic girls and pregnant women. There will be premature and profuse menses with labor-like pains and habitual tendency to abortion. So until this sentence where you can see the comparison between Alitris and Helonius is so close. Both the medicines are having that extreme tired, relaxed condition. Both medicines are having prolapse. Both medicines are having profuse hemorrhage and definitely anemic also if there is profuse hemorrhage. Both medicines are having habitual tendency to abortion. So how to differentiate it? The latter part of the paragraph is explaining how Alitris is different from Helonius. So in Alitris, there is extreme constipation, this rectal distress, what we have mentioned, or that extreme constipation, the great effort being required to produce an evacuation from the bowels. We don't see that in case of Helonius. We don't see the extreme constipation. And in Alitris, they do have a problem from digestion. So they can feel that the food is distressing and it lies heavily in the stomach. And also, there is a great accumulation of frothy saliva. So these symptoms, the constipation, the food being lying in the stomach as if not getting digested, and frothy saliva, these are the symptoms that differentiate Alitris farinosa from Helonius. So we have a set of symptoms of Alitris very similar to Helonius, and we have another set of symptoms which make it different from Helonius. So that is what we I have to see in case of Helonius in boric. Now going towards Clark. So here you will see the uterine tonic. When we go, you will understand the first notes, the exam oriented one. You will understand from where I have copied, from which text I have copied that. So in case of J.H. Clark, it is J.H. Clark who mentions that the predominantly affected organ in case of Helonius is actually the uterus, and it has been called with a justice as a uterine tonic. And the similar symptoms, one of the keynote indication is the consciousness of the womb, relaxation of uterine ligaments, misplacements, and prolapse. And then he gives a case that has been cured by Marvin Custis. And the case is like Mrs. L, age 28. She has two children, and both are surviving. She has prolapse of uterus, ulceration of cervix. Now remember this ulceration of cervix because in case of Helonius, we have already seen that there can be vulvovaginitis, extreme irritation, even toning that resulting in toning of vulva and vagina. But there is ulcer in case of cervix. And when there is vulvovaginitis or ulceration of cervix, definitely there is dark offensive leukorrhea, which we have seen in the symptomatology of Helonius. Her system is worn out. Her expression is of maximum distress. She is very irritable, very censorious of finding fault with everyone, cannot bear the least contradiction. She is restless, wants to move around, and as she feels better when her mind and body are employed. So it's exactly as like what we say in case of Helonius is the case given by Custis. And I so wondered when I read this, because when we take a case, or rather I take a case, sometimes it's a mix of symptoms, some symptoms from that medicine, some symptoms from that medicine. It is very difficult to get patient saying symptom which is correctly indicating or exactly indicating or directing towards one particular drug. Maybe the problem with my case taking also, but this one, all the symptoms, it's going towards only one drug, that is Helonius. So there was also a severe backache, a sore, heavy feeling in the womb. And in fact, as she said, she was always having that consciousness of her womb. So exactly that. Helonius 30 was given every 3 hours for 2 days and then every night. And along with that, there was a warm water injection given because she was having that complaint of leukorrhea. And then at the end of the 3 weeks, the leukorrhea had almost been ceased. The womb was in the first position, or the prolapse was cured, and she forgot that she has such an organ, that consciousness that has been lost. In women, there is loss of sexual desire in case of Helonius, and also loss of sexual desire and also power with or without sterility. Now, this sentence is important because when we are comparing about Helonius, we need to compare the other drugs which are commonly indicated for uh, prolapse. That will be sepia, murex, lilium tigrinum, platinum, and palladium. So some of these drugs, now that I will give you for to work upon, some of these drugs which I have mentioned now, they're having prolapse with increased sexual desire, and some of it, what I gave the list now, it is having prolapse with loss of sexual desire. So after my class, I'll give you this work of finding out or making a comparison. So in case of Helonius, it is loss of sexual desire. And the mental symptoms, according to Clark, it's the same thing, the depression, the gloom, the irritability. And he's saying about one of the prover when they were doing the proving. Initially, she had a feeling of wellness, and after to that, she plunged into a mental health. That's how he's explaining. Going towards the kidney, Helonius said it's mainly the right kidney that is being affected. Then all the other symptoms, albuminuria, the urine generally scanty, the pain, and then what we said in case of boric, the borders of the kidney can even be drawn out. And S.A. Jones has found the helonin, which is the alkaloid which is present in Helonius. It can turn the alkaline urine to acidic. So usually our urine pH should be 4 to 6, which means it is acidic in nature. But due to some pathology, if it is becoming alkaline in nature, or the filtration is not happening properly, when we give Helonius, this alkaline urine will be converted back to the normal, the acidic nature, the normal pH, by increasing the amount of urea. So urea, if it was not cleared from kidney initially, after giving Helonius, that alkaline urine will be converted to the acidic one, because the clearance of urea happens now uh, very nicely, and that also increases the amount of urine secreted. Now, this is the irritation in the mucous membrane that we already told, the sore mouth, burning and scalding, especially the vaginal mucous membrane. So, this is a case given by Danforth, who had a patient who was having intense pruritus, vulvar and vaginal, for several weeks. She used to say that she could tear the flesh out. That much intense itching was there. So there was vulvovaginitis, the labia and adjoining skin being red and swollen and covered with thin whitey curd deposit. So this vulvovaginitis with that characteristic leukorrhea, which was very prominent, he gave the medicine Helonius on tablets, which speedily relieved. Now this one, this annotation or connotation. I'm not sure what the term to be used. I'm not sure what is this. I asked to one of my friend what this actually means. It's not tincture, which potency they mean. I really don't understand. And even she didn't have an idea. I googled. I didn't get what is the meaning of this connotation. And anyway, when this was given on tablets, because for this vaginal mucous membrane or the candidiasis or the vulvovaginitis, where the leukorrhea is so characteristic, Helonius was given and that speedily relieved. In case of relation, they are mentioning about Elytris and Lilium tigrinum. Elytris we saw the comparisons, the similarities and also the dissimilarities. Lilium tigrinum is what we are going to do next. And Helonius can antidote the prolapse of Lilium tigrinum. And another medicine that we can compare is actually pulsatilla. So when we see pulsatilla, yeah, we can see some similarities, like pulsatilla is also having that anemic chlorotic nature, but only that much. But other symptoms like the prolapse is not that common in case of pulsatilla. And also when it comes, yeah. But the anemia is that is the feature. The menstrual complaints in case of Helonius, it is actually menorrhagia, this very profuse menstruation. But in case of pulsatilla, it is always scanty and delayed. And the Mendel mind is totally different. In case of pulsatilla, where we see very indecisive natured persons, but shy, timid pulsatilla, and Helonius, mind being extremely irritable, censorious. But that nature, especially at that anemic nature, we can think about and pulsatilla also. And some other comparison with sepia, picric acid. Um, Now, sepia, we can compare that nature, the washerwoman's, the backache, the exhaustive nature, or the extreme exhaustion, the indifference. And yeah, at this point, I'm not going to say that. That's up to you to find out. Then, in case of picric acid, which is another comparison J.H. Clark has mentioned, there is a tired, aching pain, some burning in back and also legs. Now, this symptom, we already told in case of Helonius, there is a tired sensation in the back and it will be going towards the legs. We can see in case of picric acid also. But in picric acid, it is more of a nervous or neurasthenia or nervous worn out constitution. And that is also we see in Helonius, a nervous affection. But how we can differentiate is picric acid is actually not having this prolapse symptom. They do have neurasthenia, they do have nervous broken down or worn out constitution, they do have that burning pain in the back radiating to the legs, but they don't have prolapse as like we say in case of Helonius. And another thing is picric acid is more having characteristic symptoms in case of male reproductive system. There is increased sexual desire in males or satyriasis in case of picric acid, and they also have condition, or it is also indicated in conditions, picric acid, in case of priapism. So it is in the male reproductive system, seminal emissions, extreme seminal emissions, the picric acid is more indicated. But if we are going to take only those nervous complaints, the burning out nature, the worn out nature, the extension of that nerve pain, nerve condition towards the limb, the comparison will come with picric acid. Then another medicine they have compared is with palladium, and palladium is also a remedy which is given for prolapse condition, but much similar to many other remedies what we see. But here also the main characteristic feature of palladium, there will be tiredness. This tiredness we see in Helonius, soreness we see in Helonius, irritability that is also in palladium. But what makes palladium different from what is the remedy? Helonius is the palladium irritability is very, very prominent, more than that of Helonius. That's how we can make a comparison of palladium and also Helonius. And in palladium, how it is explained that when the person is actually in a company, the palladium patient will be extremely enjoying, very much bright, or she's very active, bright, happy being in a company. But once she is out from that company, or once she finishes with that, she feels extremely irritated and exhausted. So that is one feature of palladium. And another one is in case of palladium, they like when people praises about them. Like if someone says, "Oh, you're very nice," or they compliment the person, palladium craves for that. So that nature we don't see in case of Helonius. And another one is palladium. Their affections is mainly right-sided, especially right-sided ovaries. That is mainly affected. So I can add in that features. There is just writing a simple concept here, right ovary affections. Um, they love getting praised, and the term that is used is they have love of approbation. Right? Love of approbation. Love of approbation means she likes someone complimenting her. And another one is very much bright in company, but extremely exhausted. That's with palladium. The other one important is platina, which can be given for the uterine prolapse, the menorrhagic complaint. But have you learned platina?
Yes, Pratina.
So can you say me one feature of platina and Helonius? How the differentiating
Sex
feature that I'm many? Yes, yes,
is it about sexual?
yes, yes.
The
Platina is having
hypersexual or
a,
platina? Yeah.
yes, yes. And in case of Helonius, it is asexual, or they don't have the loss,
Yeah.
they lose it. And in case of sepia, they also have no sexual desire. Platinum is having. And when we go to the other remedy, Murex, that was the work I wanted to give you, but leave it. Murex. And what in case of Murex? How about their sexual desire? Murex is
Again,
the,
doctor,
huh?
what's that? Just now you say the
Murex. Murex. Is it having high sexual?
Murex. Ah,
Yeah.
okay, Murex.
Is it having high sexual desire or less? Anyone knows? I can just adding it over here.
High. Murex, is it?
Yes.
High. Yeah,
So all the
easily
products,
excited.
so all the medicines which are not just to sexual desire increased, right? I'm just concentrating. Another one will be the mm, Teresa. They are also highly sexually tarantula, sexually high desire. But I'm concentrating, and this one I'm just indicating those medicines which are having prolapse and also high sexual desire. High sexual desire. One is William trick, then Latina, Lorex, and low sexual or even absent sexual desire is relapse. That will be Sophia and Helonis. In case of palladium, it is not mentioned how about its sexual desire. Going towards Farrington, I think when we go through all these steps, we get to remember what are the main things to be remembered. So, Helonius, once again, a repetition, the tired, aching feeling, the burning pain which is felt in the back and radiating towards the leg region. And this is a very common feature, especially with women. And Farrington says that no remedy, unless it is picric acid, relieves more promptly, especially that nervous, worn out feeling. But the thing is, picric acid doesn't have the prolapse, but helonians do. But here, what he is mentioning only that nervous worn out or that neurasthenic feature only, Farrington is saying. The debility of helonians is actually the result of an impaired nutrition. So if the prolapse you try is due to this general defective nutrition or that lack of ligamental tonicity or the musculature tonicity and not due to any local congestion, we can think about all these medicines, Sepia, erythris, Colophyllum, Ibis canadensis, lactichlorate and calcareous, Natrum helonius, and Natrum hypochlorosa. I don't have to remember, just compare the litris, Sepia, and helonius. That will they seem to feel better when they are working than they did when they started to work. And now this is where the explanation comes from. This is not the Restrock's condition. It is not due to the limbering up of stiff joints as under the latter remedy. The reason for this symptom is that some of the languor or that stagnation it passes off as the patient continues her labor, or when, or in other words, when she is involved in other works, she just forgets her complaints. So this is how that Restock's differentiation was made by Farrington. Then this is about the consciousness, how he explained that. You know that we are not conscious of our internal organs. I'm just reading because I have explained you this earlier. I'm just reading how it is given in the text. They move and perform their respective functions without any sensation. The minute our sensations tells us that we have a stomach or liver, that minute we begin to have disease though. That's how Farrington has given. So now he is giving a case. He can recall a case which he treated in the last winter. It was of a lady who gave birth to a very large child. And as a result, she was suffering from prolapse uterine. Farrington gave her several remedies without relieving her, so that at the end of 3 months, she was still uncured. At that time, she began to complain about a tightness across the chest with cough and some little bloody sputum, which indicates a condition of tuberculosis or something. And then, while the history was taken, Indeed, he found out a condition where her mother had died of phthisis after giving birth to twins. So Frampton feared whether the patient is also having a very serious lung affection. So the tactical remedy, phosphorus he gave. I'm not sure why Nux was given because Nux is not bad having characteristic blood sputum. However, Frampton gave her Nux also, but no good. And then he studied the case more thoroughly, where the patient told that she is having a very strange symptom, that is a heavy weight over the chest, on the sternum, and a feeling as though the chest had been gripped in a vice. And now that is a sensation usually felt in case of angina. And when we go to Lilium tigrinum, we can see such a symptom also, because in Lilium tigrinum there is affection of heart. But however, the symptom was said by the patient where there is a heavy sensation with the sore feeling, and this annoyed her when she awakened at night. And this symptoms has been noticed only in the male provers of Helonius. This chest symptoms, a sore sensation over there, the heavy weight sensation, because in the female it was always getting concentrated in the sacrum, the pelvis region, but over the chest it was mainly for the male provers. And anyway, when the patient told about this symptom, he tried Helonius and it was relieved. Um, and what Nash says is simply those symptoms which which I have not told anyone. Um, the same symptoms actually: hard work, mental and physical. There is a sensation of sore, tender uh, uterus, which is seen in lysine and murex. And these symptoms we can see in puberty, during pregnancy, or after labor, and all these conditions, Helonius is a blessing. And Nash has found that this medicine is efficacious in the second and the third tier potency. According to the susceptibility, Helonius deserve a thorough proving in all the potencies. So that is about Helonius, a very nervous, worn out constitution, either due to luxury or due to the excessive hard work, which results in any prolapse or malposition. Remember about the diabetes, the albuminuria or the glomerulonephritis, and also about the vulvovaginitis that makes Helonius, and the frequent bad effects of what is that? Abortions or miscarriages. Now we go to a small drug that is Jonosia asoka. I seriously don't know whether this medicine is available over here. This is actually a tincture, an Indian medicine per se. And as I always say, I don't understand why these tinctures are usually prescribed when we do have other medicines, other potencies. But still. So Jonosia asoka, it is the part used is the bark of an Indian tree, and the prover is Dr. N.D. Ray from Calcutta. So this is the medicine, or this is the tree. Have you seen this tree over here? No.
So I'm not sure. Is it the same with the one that in a housing area that we can pluck the small flower and we sip the middle taste sweet one? I'm not sure. Looks similar.
This flower is actually edible. I mean, we can in my home, in my like ancestral home. Okay, when my grandfather would, at that time we had a big tree, and this flowers. It will be in bunch, and they used to pluck this flower, and it is actually bitter. But what they do is they put it in salt water, and then dry it in the sun, and once it is dried it will be uh, deep fried in oil. So like a puppet, we can use something of that sort, and that at that time it won't be any bitter, and I used to love it very much. So this is actually edible like that. I don't think you over here it may be used, but this is the plant actually. So characteristics, this is actually given for all the uterine complaint. Either there is amenorrhea or menorrhagia, meteorrhagia, this is indicated. When there is no blood or when there is excessive bleeding, this medicine is indicated. So it has an extensive sphere of action on female organs. Amenorrhea and meteorrhagia is the feature. In mind, there is a weeping tendency, the patient is restless and hysterical. There will be headache, which is unilateral, and usually this is a reflex of uterine complaints. And this headache will be ameliorated in open air by free flow, that is hemorrhage, and also via bathing. In eyes, there will be photophobia, pain in eyeballs, and supraorbital pains, a blurred vision, and swelling over upper eyelids. In nose, there can be nasal catarrh, profuse watery discharge, and loss of sense of smell. In gastric complaints, there will be aversion to milk, desire for sweets, and also acid things. There can be thirsty with excessive nausea and white or brown clotted tongue, obstinate constipation, and also hemorrhoids. Now, you can see that in this one, I have colored only the headache because I felt it is very important. And later, when we go to the cured cases, we see some of the doctors, they have cured the headache, which is a reflex complaint of uterine complaints. But then I never understand because there are various other remedies like this is sepia, which can be thought about very good action on headache, which is a reflex of uterine complaints. Then why do they give this tincture? I always wondered. I have never got a correct answer for that. So, for the exam purpose, I won't say you to remember all these things because there is nothing characteristic. Weeping tendency, restless, hysterical. I don't know whether you should remember also all these things. It's only the female complaint you need to remember, but just because this were there in the textbook, I just copied it because I never liked the prescription of tinctures. So, coming to the female, as I told, there will be delayed and irregular menses. The suppression of menses can result in headache, so that unilateral headache or the reflex of uterine complaints, and that headache will be ameliorated by flow. There can be amenorrhea, and then before to the flow, there may be pain in ovaries, but still there is no blood coming out. But this is also indicated in case of menorrhagia, and the nature of the blood will be blackish, foul smelling, scanty, and also pale. The lochia might be the discharge that is coming out after the delivery. It will be long lasting, black with a fetid smell. There can be bloody leukorrhea. It is found that it is a great medicine when the menses has been stopped for any cause, like a secondary amenorrhea, and after to that, a colicky abdominal pain supervenes. So for the menstrual colic. So if we are going for the characteristic symptom, the medicine that can be given like for amenorrhea and also menorrhagia. When we say about amenorrhea, there can be pain in the ovaries, there can be delayed or irregular menses, and the suppression of the menses or amenorrhea may result in headache. And when there is a flow of blood, there will be amelioration. And then this is something we can see in lacasis and zingamet. I don't know why this medicine was given. Then the blood, even if it is coming out, it will be very blackish, very offensive, uh, and long lasting or false smelling. That is the feature. And when menstrual flow has stopped and the colicky abdominal pain has supervened, then we can think about this medicine. This one I give up to your choice to study. I will maximum try not to ask question from this. Only if I don't get any other drugs, I will be putting this. I leave up to you to study this because even if you study, I'm not sure whether this medicine is available over here. Is it available? You know? Have you anyone given Jonosia Ashoka?
No.
Yeah. Like this may be like when you don't get a correct feature and there is extreme hemorrhage for the patient or the menses is not appearing, then as like a single shot. You want to give something, and then you would think about Jonosia. Sleep will be disturbed with dreams of traveling, pain along the spine radiating to abdomen and thighs, usually given in tincture. And for the cured cases, this one is given by Gupta or Gupta. He had cured cases, not just one case, many cases of one-sided headache due to uterine troubles and backache. In tincture form, 5 to 10 drops 6 hourly. He also has cured case with complaints of leukorrhea, amenorrhea, painful menses, pain in ovaries with Jonosia asoka in tincture form, 5 drops 3 times a day. When we have a lot of remedies, I once again say I really don't understand why it is being given. Now, remedy relationships, it is usually used as an intercurrent remedy. Okay. When medicines are given in between a appearing of menorrhagia may be given as an intercurrent and a complementary to other tinctures. Abroma, Augusta, Viburnum opulus. Viburnum opulus is actually very good for menstrual colic. Pulsatilla and also sepia. So that is the feature of Jonosia asoka. Now we go to the next important remedy, Lilium tigrinum. Would you like to have a break now?
Okay.
Okay, we just take a 10-minute break and stop the recording. We restart after 10 minutes.